Hey, good morning, guys. My name is Danielle, and I'm a nurse at the University of Louisville Hospital in the emergency room. I just want to talk to you a little bit today about metoprolol and low pressor, which are beta blockers that are commonly prescribed to our patients outpatient from the ER. So, low pressor or metoprolol is a beta 1 receptor blocker used to treat hypertension, angina, acute MI, tachycardia, and CHF. The heart has two main alpha sympathetic receptors, beta 1 and beta 2. These alpha receptors are located in the arteries and are stimulated by our adrenaline, epinephrine, or norepinephrine. When the arteries are stimulated by this adrenaline, they constrict, which causes an increase of blood flow and for your blood pressure to go up. Beta blocker medications block these effects of the adrenaline on the body's beta receptors and slow the nerve impulses, bringing the heart rate down and the blood pressure down. There are two main types of beta blocker medications out there. There are beta 1 blockers and beta 2 blockers. Some meds are called selective medications, which means that they block beta 1 receptors more than beta 2 receptors. There are no examples of clinically useful just beta 2 antagonists. There are some medications that affect both beta 1 and beta 2. Examples of those that you may have heard are propranolol, nadolol, and timolol. So you can hear those prescribed for some of your patients. Examples of beta 1 receptor blockers other than metoprolol are atenolol and esmolol. The cardioselective beta blockers are useful in hypertension patients who may have impaired pulmonary function because they do not affect the beta 2 receptors that affect the bronchospasms in the lungs. Also, beta 2 medications are good for patients who have peripheral vascular disease because they don't affect the beta 2 receptors. One of the common side effects of beta blockers can be cold extremities or Raynaud's that you may have heard of, but that is less frequent in patients that are on just the beta 1 receptors. So some contraindications why you wouldn't want to give your patients this medicine or why you wouldn't want to prescribe it. If they have an AV block, obviously if they have bradycardia, cardiogenic shock, decompensated heart failure, or sick sinus syndrome. The most common side effects of this medicine are hypertension and bradycardia, bronchospasms, heart block, and heart failure. So because it's prescribed to a lot of our patients, I know cost effectiveness is always an issue. This medication is listed on the $4 drug list at one of our major retailers here in the United States. So patients can get a month's supply for $4. They're normally prescribed it twice a day because it does have a half-life of only 3 to 7 hours. And they can also get a 90-day supply for, I believe, $9. So that's pretty good and pretty cost effective for them. So be sure to let them know that if you do have a patient that's prescribed. Even if they do have insurance, it may be a little bit cheaper for them to get it somewhere else. So thank you for listening, and I'll see you soon.